Welcome back to the show. I'm Carl Cannon, Washington Bureau Chief of RCP, and you're listening to Real Clear Politics on SiriusXM's Channel 24, POTUS channel, or maybe listening and watching on our podcast. Anyway, I'm glad to welcome now Stephen Ross Pomeroy, who's the editor of RealClearScience. It's don't tell Tom Bevan this, but it's probably my favorite vertical that we have. Welcome, Ross.
Much appreciated, Carl. Happy to be here.
So, we've got this, it's an interesting development in the intersection between science and politics. Jay Bhattacharya, Stanford professor, who we gave the Samostat Prize to last year, is replacing his nemesis, Francis Collins, at NIH if President-elect Trump gets his way. And I know both these guys. I know Francis really well. I know Jay. I like them both. They're both the most unusual, deeply sourced, impeccable scientific credentials. They also happen to be practicing Christians, but they had, Francis kind of went after Dr. J during COVID, and now he's taking his job. We've talked about that on the show, that the it's almost a soap opera dimension and a human drama. But looking ahead, Ross, what are we likely to see changes at NIH in the National Institutes of Health, which has this huge research budget? What, as a science writer, what are you looking for if Jay is confirmed, a change of direction, if any?
Yeah, and in the past, Jay has made a lot of statements to this effect. A lot of big changes potentially coming to NIH. Most broadly, just recently in his tweet, he said he was humbled to be nominated by Trump. He said, "We will reform American scientific institutions so that they are worthy of trust again." And obviously, their trust has been eroded pretty heavily in the wake of the COVID pandemic.
So what is that? How does that translate into policy differences or differences in priority or emphasis or spending, as you see it? I mean, I know I'm asking you to project ahead, but what do you be looking for in terms of how that ethos translates into policy?
Yeah, and I'll tell you what's interesting about Dr. J is that he got his big name by being a quote unquote COVID lockdown denier, and getting castigated by a lot of people on the left for that stuff. But before, he's a health economist, and he's actually written about NIH practices pretty copiously in the past. He's participated in NIH review panels, so he's pretty knowledgeable about how the NIH works. In a 2018 working paper, for example, he wrote that the NIH could do more to promote innovative science, arguing that scientific and political considerations have led the agency to inadequately fund exploration into new ideas. He has also written that scientific breakthroughs has stagnated because scientists were wrongly focused on just simply being cited by other researchers. In short, he thinks that the NIH has really lost its way by really becoming a part of the sort of publisher perish business focused aspect of academia, where the business of academia and science has just become to get grants from the NIH.
Well, you know what's interesting, Russ, is I hear you talk about this. I'm reminded of President Biden's moonshot to cure cancer, which when he announced when he was vice president. We haven't heard a lot about it recently, but moonshot was a fascinating metaphor because it reminded me, people my age, of John F. Kennedy's, wanting President Kennedy committing Americans to go to the moon. He didn't live to see it, but his promise was fulfilled. We did it by the end of the decade being the 60s. But there's a thought, in NASA, certainly in NIH, in government, big government programs, that the pioneering, the new frontier spirit finally succumbs to bureaucratic norms and bureaucratic realities. Does Jay Bhattacharya, is he a person who can inject NIH with the kind of spirit that President Biden himself was talking about when he just said, we got to cure cancer and, we'll figure it out, and just sort of committed, but suggesting that, research, we're going to find new ideas. We're going to find new things. We're going to go in new ways.
I think he really can. Again, he's written on this in the past, and even in interviews has said something to that effect. He wants to restructure the NIH, quote, so there's more centers of power. So it's not just scientific bureaucrats that have just been there for decades making decisions. For example, one thing in science it's always said is science only advances with funerals. And that's because people who have been entrenched in academia and honestly getting really the ones that get all this NIH grant money are the ones who get all the money. Their ideas get credence and get all the attention. I think Jay's going to try and really go into that agency and really break apart the influence that's just been restricted to, like you said, a few scientific bureaucrats.
When COVID came, I spoke about it. I wrote about it for Real Clear Politics and talked about it on our podcast. Then we had our early podcast. Um, you know, Tony Fauci to me was what I thought initially perfectly positioned. I'd covered him. I'd covered the AIDS crisis, and he had been innovative. He himself had bucked the establishment. He'd been empathetic towards the sufferers of AIDS. You know, they were hard to win over. They hung him in effigy and ended up having dinner parties at his house. And he really listened. And I thought he was the right guy. But by the time COVID hit, he was 80. He was 80 years old, or almost 80, entrenched. He wasn't the same guy. He didn't bring the same sort of the same creativity to looking at this new virus that he did at the other one. And I ended up being, disillusioned a bit. What were your thoughts about Dr. Fauci?
I mean, well, he's a sort of a stubborn guy. I'm sure you probably could realize that from all his interviews. But I mean, he's also very knowledgeable and he had a way of doing things. And one thing we should be clear about too is that it wasn't like he was on an island with his beliefs. I mean, a lot of other researchers and academics and public health officials were basically saying the same things that he was saying about COVID. And it was a tough time too. I mean, we were in the middle of a pandemic, the likes of which we hadn't seen for 100 years. And I think a lot of, especially people in Dr. Fauci's position, really wanted to be more cautious. And maybe that caution, as we're learning now, was a little too much to the detriment or a little overboard.
You're listening to Stephen Ross Pomeroy, editor of Real Clear Science. I'm Carl Cannon, Washington bureau chief for RCP. Ross, let me ask you about another guy who's been in the news. He's very different than Jay Bhattacharya, who's humble and, and sweet. He's an acquired taste, let's say. I'm talking about Bobby Kennedy Jr., who, I'm reminded of the old description of Winston Churchill. He he's a bull who carries his own china closet with him. Uh, but at HHS, I thought some job, but maybe even attorney general, which his father had. But no, he wanted HHS. He got it. People over there, the establishment is worried. What are you looking for in a change of direction at that agency if Robert F. Kennedy Jr. is confirmed?
And yeah, to your point, yeah, he's got a lot of big plans, but he's going to have to be approved first. And right now, um, uh, Trump's defense nominee, Mr. Hegseth, is getting all the attention, and a lot of the press is saying he's going to have a difficult time getting through. But RFK Jr. is also going to have a lot of trouble getting through, and that's something that's not getting covered right now. But it's going to be a difficult road for him, I think.
What are the things he said that are most troubling to people in the Senate, would you say?
Yeah, let's be clear too. He's also said some pretty reasonable things. Let's start off with those. So he
Okay.
wants to remove ultra processed foods from school lunches.
Yeah.
Hard to find a disagreement there. Ultra processed foods probably not good for our kids to be eating in such great quantities. Called for banning hundreds of food additives and chemicals such as food dyes. These are chemicals which have actually been disallowed in Canada and the EU. Pretty reasonable, actually. A great demonstration of that you can see if you look at Canadian Fruit Loops. Their colors are a little duller, but they also don't have those artificial food dyes that are present in the Fruit Loops in
Well,
the U.S.
maybe he'll get some Democrats to support him then. All right, we got about a minute left. All right, but what are the things that are going to cause him problems?
Yeah, so one of the big things is obviously he wants to remove fluoride from drinking water, says he'll do that on day one. Right now, there's about 3 drops of fluoride, the equivalent of 3 drops of fluoride this would be in that 55-gallon barrel for our drinking water. That helps get rid of cavities, especially in poor populations that don't have access to toothbrushing and fluoride toothpaste. But of course, the biggest one is vaccines. He's made many false claims in the past that vaccines are linked to autism. Uh, in 2019, he went to Samoa and spoke to a lot of officials there about problems with the vaccines. And there was subsequently a large measles outbreak there where 83 people died. What he says there is he doesn't want to take away vaccines from people who want them, but it's very possible he can make it much easier to get exceptions for vaccines, which would
Is
obviously lower uptake.
is he going to have to back off those statements a little bit to be confirmed? Would you say 30 seconds?
I think he definitely will, but I'm not sure. I think he will need to back up those statements, but I'm not sure if he will. He's been a hard-headed reformer, quote, for years, and it's going to be tough to get him off those positions. And of course, he has a way of sort of sanitizing the bit. He says he's not anti-vaccine, and that obviously anybody who wants a vaccine will be able to get them, which is again, like I said, probably it's definitely going to be true, but he's probably going to make the exceptions for people who don't want vaccines much easier to get, which could endanger herd immunity in the United States.
Well, that phrase you used, Ross, hard-headed reformer, they seem to go together. We're going to leave it there. Thank you very much for being with us. I'm going to turn it over now to Andy Walworth, who's going to be talking in our next segment to Bill Galston of the Brookings Institution. Don't go away. We'll be right back.